Now, moving on to nutritional management of urolithiasis or lower urinary tract disease. The first term that I want to discuss is relative supersaturation, and this term applies to the chances of solutes to precipitate versus to stay in the solution. And it's based on a computer-based modeling technique based on the thermodynamic behavior of the compounds. And that takes into account the concentration of the compounds of the solution, the pH, the temperature, and the interaction between different compounds. So we have three ranges that we look at. We have the supersaturated range, which is where there is a high risk of precipitation. We have the metastable range, which is where we don't have a high risk of precipitation, but we don't really have much of a chance of dissolution of the crystals. And then we have the undersaturated range, where we usually aim for in these patients that have a high chance of urolithiasis, because this is where the chances of precipitation are the lowest. And in fact, for some crystals, we have a better chance of dissolution. In dogs, anything that can predispose the dog for a urinary tract infection, such as obesity, or being a female, or anatomic changes, endocrine diseases such as diabetes, that increases the risk of urinary tract infection, immunosuppression, or dermatological disease, especially in the urogenital area, can increase the risk of Struvite urolithiasis. In cats, we really don't know what are the predisposing factors for Struvite urolithiasis.